thing we're going to look at today is use of Celops gauze. This is for treating a severe to a catastrophic bleed. It basically works by attracting all the clotting agents in the blood, and it forms a very sticky clot very, very quickly. The Celops itself comes in a bandage form, so whilst it looks like a bandage, don't roll it around the wound. It's designed to be packed straight into the wound. To do this properly, it's a two-person job. So my assistant here is going to be applying direct pressure. This buys me the time to prep my Celops and get everything ready, because it's all about buying time and keeping as much blood in the body as possible. So what I'm going to do is keep the Celops rolled up, and then working with my assistant, as soon as I'm happy, she's going to remove the pressure. So when I say now, I want you to remove the dressing. Okay, now. And then as soon as that's away, I start packing as much Celops as possible into the wound. Don't pack it in too aggressively, because you could cause extra trauma, and expect to get a fair bit in, because the Celops dissolves a wee bit as it goes in. Very quickly that forms a clot. Once you've packed the wound, tear it off the roll and then pressure straight back on. It works in conjunction with direct pressure, so that pressure now needs to be applied for at least 3 to 5 minutes in order for the Celops to work. Once that's done, we can then dress the wound as normal and just reassess to make sure the Celops is doing its job. A couple of things to avoid with Celops is trying to pull it out again, because it gets sticky very, very quickly, and you could end up causing more trauma by removing any Celops. Just leave it in the wound and it'll be removed later on in a hospital theatre. This is the combat application tourniquet, otherwise known as the CAT. It's designed for stopping a catastrophic hemorrhage, particularly seen on the battlefield, but also in any other kind of pre-hospital emergency. All it is a Velcro strap. It's got a double buckle at one end, a windlass to tighten the tourniquet, and then a little Velcro clip to secure it. When I use this, all I'm going to do is make sure that the casualty or somebody else is applying direct pressure or indirect pressure. Try and stem the bleeding, because these can be a bit fiddly, and I want to keep as much blood in the casualty as possible whilst I'm getting it on. Start off with it fully opened up. I'm going to get this around the casualty's leg and above the wound. Make sure it goes above the injury, otherwise it's not going to do any good. Make sure you've double buckled the CAT. That's because this Velcro is particularly rubbish when it's covered in blood. It's not going to stick very well, so it needs to be double buckled to make sure that that it sticks and it grips properly, it doesn't work itself loose. Then, grabbing a hold of the windlass, use that as your anchor, pull as hard as you possibly can to take all the slack out. Then tighten that windlass up, keep turning it and keep turning it. Only stop when the blood stops coming out of the wound. That shows you your tourniquet's been effective, and then secure it using the Velcro catch. That's your tourniquet applied. You'll find the patient will find that more painful than the injury themselves. They will probably need more analgesia for the pain of the tourniquet than the actual injury, but you have to get it tight enough until the bleeding stops, no matter how much your patient whinges about it. Once it's in place, don't remove the CAT. It's doing its job, leave it there. Only remove it when you're at definitive care.